And we're live. There we go. Good evening, everybody. Welcome in as you all come in. I just hit the live button. So, welcome in. Appreciate you coming in tonight and watching the show. We'll kick off the main portion of it in a little bit once we get more people getting their notification and joining us. So, it's nice to see. Nice to see you. I see some people coming in now. So we really do appreciate that. So if this is your first time watching, I want to welcome you to my channel where we mainly focus on glioblastoma brain cancer. Also, how all the things that come with cancer, talking about the radiation cycle, the chemotherapy cycles and what to expect, MRIs, how those go, what to expect if you've never had an MRI, and really just my overall journey. I am now 8 months removed from surgery to remove the glioblastoma, and I am starting month 9 on the 13th. Will be exactly 9 months from surgery. Very, very happy with where I'm at. But again, that's what we cover here in this channel. We have a great community here. I invite you, if this is your first time here, or if you've been here before and you may not have done it, down here on YouTube, if you could hit the like button, it's the thumbs up button. It really helps the channel. It also helps me know that you like the content that we utilize here. Also in Suites and Beyond, hello to you, one of our resident visitors here. So yes, thank you, Suites and Beyond. Hi, everyone. Hit the thumbs up on your way in. Absolutely. And then if you haven't subscribed, I invite you to subscribe. It doesn't cost anything. You just got to hit the subscribe button. And once you hit the subscribe button, it should give you a bell. If you hit that bell and select all, that will let you know every time I post a new video, I go live like I'm doing today, or I post something on my community tab. So that way you're not having to constantly come in and look and wonder, when's Patrick going live, or different things like that. You'll get a notification as long as you have the notification bell set to all. So it'll come right to your phone, and I'm subscribed to quite a few people, and it makes life so much easier. So, hey, Suites and Beyond. I really hope you had a great day today. And once we get a few more people in, then I will kick off today's show talking about Dr. Olivera. Oh, I'm sorry. I've got people, they all work from home who work for me, so they're all over the place. And one person was experiencing something very similar and had to leave as well. But it's because of the barometric pressure drop where they're at with all the bad storms and tornadoes and everything. It just, it wasn't a good day for them. So, I'm glad they left early to take care of themselves, because it's pretty crazy out there right now. Sweet. I'm curious, did you go watch the launch the other night? I think it was it Wednesday night? Could have been Tuesday, but it may have been last night. I got a decent video from my backyard. I'm sure it's going to be a lot closer. Well, yours would be a lot closer than where I am, because I'm 100 and some odd miles away, or maybe 200 miles. So, but hey, that's awesome that you, that it was that close to you. I love that. Hello, Mod148. Thank you so much for coming back in and saying hello. I appreciate that. I always forget. Yes, it was nice. Yeah, I can only imagine. I mean, it was orange. I mean, you could look like an orange fireball shooting through the sky over here. So I can only imagine how bright it was over there. Hey, Sarah Z, welcome, and it's always nice to see you. Thank you for coming back in. So I'm going to just get started, and I want to talk about a very special individual, and I actually have his information right here. This gentleman's name, and some of y'all are going to get mad at me because I'm not rolling my R's, but this is Dr. Raul Olivera. And Dr. Olivera was my neurosurgeon. Um, it was, you know, it was amazing to have him, and I'll get into why in a second. Mod 148, we have hail, ice, and thunder going on right now. Well, okay. I'm glad I'm in Florida where it's 87 degrees. So yeah. All right. So Dr. Raul Olivera, again, my neurosurgeon. Uh, I had no idea I was going to have him as my neurosurgeon. I didn't get to pick my neurosurgeon. So as the story goes, I had a focal seizure followed by not being able to really stand up without falling down in the house. So in July of last year, I was taken to the hospital, the emergency room actually, where they didn't really think I had anything wrong with me, except that I couldn't, my balance was off, maybe vertigo, maybe something else. But they did a CAT scan just to be safe. And that CAT scan showed I had a mass in my head that was pushing up against my brain. Now it makes sense as to why I had a focal seizure and why I had no balance. So once they discovered that, they immediately took me by ambulance from the emergency room to Advent Health Tampa Hospital. And Advent Health Tampa Hospital, I got to meet a person by the name of Dr. Raul Olivera. Never heard of this guy before. Was one of the most, I mean, for me not knowing what was going to happen and what everything was, he we shared, there's a pretty nasty looking mass in your head and we need to get it out or it could cause a couple of things. It could cause more seizures. It could cause a coma. I could have a stroke. All kinds of things you never want to hear. So, he made it pretty clear that it needed to come out. And he was going to be the surgeon. So he ordered an immediate MRI, and I had an MRI the night I was taken to the hospital. And then the next morning, he came in and he saw me and he said, the MRI confirms that it's definitely a mass in your head. And he showed the images, it's pushing your brain to the side. And yeah, he's like, we definitely need to do surgery. So in a day or two, we're going to set you up for surgery. Okay, great. Well, I had so many nurses, so many techs, so many attending physicians that I had never met before find out that he was going to be doing my neurosurgery to remove this tumor from my head that was pushing up against my brain. And yes, Mod 148, I did have just one episode when they found it. So all these surgeons, nurses, and techs were all telling me how fortunate I was to have Raul Olivera as my neurosurgeon and how blessed I was to have him because he's the greatest in the country. Doctors, his peers saying that. Again, the nurses who love working with him saying that. And if it was their children or their family, he's the only one they would allow to touch their family from a neurosurgeon perspective, and that was unbelievable. In Mod 148, you took the words right out of my mouth. Yes. You know, sometimes people think it's cliche. Christians will say, God's timing is perfect. This is a perfect example of how that happened. And I haven't even shared. He just transferred to that hospital from a different one that week. So God led him to that hospital. I was his first surgery at this hospital, and there was a reason for that. God put him at the right place for me. So I was very fortunate, and he truly is an amazing surgeon. So let me catch up on the comments here. The first one, Sweets. It reminds me of the TikTok of Dr. Now. Mod 148, neurosurgery is such a highly skilled surgeon. I worked for one for a few years. Can't stress that enough. If you're a quarter of an inch off, you could cost somebody their speech, their ability to walk, talk, see, hear, all the motor skills that we take for granted. One little nick, one little, just a little bit off can do that. And that's why this is such a highly skilled position. And yeah, it's crazy. Maria, it was so scary, especially because I only had one episode. I had no other symptoms of it. Nobody thought anything was wrong. Just I had, vertigo or something like that. So, yep. And Sweets and Beyond, he is Cuban. It's actually funny. After surgery and after going home from the hospital, I was referred to go see. They're still in the same group. So Advent Health down here in Florida is one of the big ones. And so I was in an Advent Health. And so they sent me to an Advent Health radiation oncologist. And Dr. Olivera highly recommended this radiation oncologist. And that guy was amazing. But the radiation oncologist called Dr. Olivera in my first meeting with him, the Cuban Missile. He said the Cuban Missile shot right in there and just got every bit of that tumor. And, I couldn't have been more grateful for it. But yes, so he is Cuban. He's an amazing, amazing guy. And yeah, I mean, I don't know much about the doctors coming from Cuba, but if they're anything like him, go. If you need to see one, see him immediately. This man, I am so grateful God put him in the right place for me. And it truly is amazing to think back to, I could have had any neurosurgeon, there, but it had to be Dr. Olivera. And I'm just so blessed for that. Hey, Cree, thank you so much for coming in. And I appreciate you listening while you cook. That Lauren Marie, thank you so much for being in here again. I really do appreciate that. So, I wasn't lucky. I wasn't fortunate. I was blessed by God that Raul Olivera moved to Advent Health from his Wesley Chapel location to Tampa to the Advent Health Tampa. And it's just so amazing. Hi, Barbie. I'm sorry to hear that. Yeah, brain tumors are just a horrible thing. But I'll never forget after recovery, or not recovery, after I recovered in the recovery room. Actually, the recovery room was my private room there at the hospital. I was very happy to have a private room. But it's just one of those. When he speaks, you feel the passion in him. And I'll never forget my mom shared this with me. My mom sat through the entire surgery. There was 7.5 hour surgery. Dr. Olivera would frequently send, whether it was a nurse, another doctor, somebody out to give updates on how everything was going. And so my mom wasn't there alone. And this is why I tell you how blessed I am. One of my friends, been one of my best friends since elementary school. His name is Jimmy. He went up there and sat with my mom during the entire surgery. Didn't ask him to do it. He did it out of the goodness of his heart because he wanted to be there. My friend Joe, who you've met quite a few times, wanted to come up there. I mean, has sent so many messages. Hey, can I come up yet? Can I come up yet? Because they limited how many could come. And we were like, no, not yet, but soon enough. So my mom was there, my aunt and uncle down here, my Aunt Sharon and Uncle Jim down here in Florida. They came and sat with my mom. A couple of my mom's friends came and sat with her friend Eugene, her friend from Church Mona, my friend from Church Mona as well, came and sat with her. And I'm sure I'm missing somebody, but just an absolute blessing to have people like that in your life. And so at the end of the surgery, Dr. Olivera came out and talked to them all and said, couldn't have gone any better. He is very confident that he got all of the tumor and residual. And so, my mom asked if she could give him a hug, and he was like, absolutely, you can give me a hug. And she did. And he's just that kind of doctor. Great personality, great bedside manner, and truly has a passion for this kind of specialized surgery and everything like that. So let's see. Maria says, hard to get a private room in hospitals around here. In general, it's very hard. I don't know how I got one, but I was on a specialized floor. I was on a neuro ICU floor before and after surgery. So maybe that's why, but I'll take it. Sweets and Beyond, when my hubby had surgery a couple of years ago, they gave me an ID number and they would update a screen. Yeah. My mom had surgery at a different type of hospital. And that's what they did. They took her away and they gave me a number, said, watch the screen up there. I'm like, what? That's crazy. Oh man, William Brooklyn, how's it going, bud? Man, it's so nice to see you. I'm sorry I didn't go last night. I know probably would have helped, but I apologize. I didn't go last night. Stephen, I appreciate you being here. Georgie and friends as well. Thank you. And Stephen for coming back. Same with you, William Brooklyn. You've been here numerous times. I appreciate you for coming back. So, man, it's so nice to see you all in here. So 7.5 hour surgery. And think about it. After I slept through the night, after surgery. So this was the day after surgery. Dr. Olivera came in. They did a bunch of neuro tests on me. They always checked my eyes. They asked me to squeeze their fingers. I was a little hesitant at first because I didn't know what was going to make them do. But okay, I'm just kidding. Had me squeeze their fingers. They were testing my strength, had me stand up. They were testing my balance, and they were just amazed. They're like, can you believe this guy is not even a full day, but hours removed, 12 hours removed from surgery, and he's able to be on his feet. I'm like, I can walk if you want me to. And they're like, what? Are you serious? And I'm like, I was told how great my surgeon is, so I believe every bit of that. And so later on that day, the what were they? The physical therapy and occupational therapy ladies came in. to sit me up. They just wanted me to sit up in the chair. And when they came in, I was already sitting in the chair. They're like, again, how did this happen? I'm like, well, there was a walker there. I grabbed onto it and I walked to the chair and sat down. They're like, you use the walker, right? I'm like, I use the walker. I'm not going to fall. I don't want to fall. And I understand the risk at the hospital for me falling. So I wasn't going to do that to you all. And then they asked if I could take maybe slide my feet. And I'm like, no, I can take a few steps if you want me to. And they're like, you really can? I'm like, yep. So I took a few steps. Georgian friends, the only time I felt dizzy was when I immediately stood up. Like I had to just tell them, let me get my bearings. Took about 5 seconds maybe. And then I was fine. So standing up right after, the day after surgery, I definitely would feel dizzy. And then they asked me to walk a few steps. Can I walk over to the sink and brush my teeth? And I'm like, you want me to walk around the floor? I can do that too. And they just started laughing, like, who is this guy? So I started walking out my room. Of course, they were with me. Um, I didn't have, I would say, full strength in my left leg. My left leg felt weak. Right leg felt amazing. So they're like, okay, that's a good job, but we can see the weakness in your left, and so that's something we'll keep an eye on and keep working on. So let's go back in the room and brush your teeth. So, I was able to unscrew the cap, put the toothpaste on the toothbrush, and brush away. So they were happy with that. Was able to drink, and then had a little bit of food. I was on a liquid diet for most of the first couple days, which I understand, but it sure kept me hungry. But yes, I did pretty much amaze them. Even the doctor who was on the attending physician on the floor, when he came by every day, a very nice gentleman from India, he was like, your chart is the most amazing chart we've seen. I can't believe what we see. I couldn't believe when I saw you walking around with your walker yesterday. I said, yep, that was me. And then let's talk about 2 days after surgery. Same occupational and physical therapy team came in. They asked how I was feeling. I said, I really do feel great today. I feel like I could run a marathon if you wanted me to. Said I'm not going to, but I feel like I could. And that day with the walker, they had me walk around the middle area of the floor that I was in. And they were amazed. They're like, okay, as we walk past this room, I want you to read me the room number. And I looked, I was able to read the room number. That was an eye test. And also to see if I might lose my balance if I had to shift my focus real quick. And I didn't. That was absolutely, it was easy for me. And they're like, all right, we're going to do a U-turn here. And I want you to find room number, blah, blah, blah. And I did. So I was back in my room, back on the chair, sitting up watching TV. And then the third day post-surgery, I asked them if I had to use the walker. I'm ready to go without the walker. And they asked if I was sure. I said yes. And they're like, well, we have to stand behind you. I'm like, that's fine. I understand. I get risk. I understand that well. So I was able to walk the entire floor that day with no help. No walker, no nothing. So get back to the room, and they're like, all right, you are remarkable, and you earned your black belt. I'm like, cool. What does that mean? And they said, well, we're going to be holding on to you. We're going to give you pretty much the freedom to walk when you or not when, but when we come in tomorrow, and you can walk anywhere you want. but we have to put this big black strap around you and hold it. It was almost like a leash. Hated to say that. They would put it around my waist, and it was easy for me to walk. They're like, "Hold on, you're going too fast." I'm like, "You told me you wanted to see me um, walk, and I walked." And they're like, "Okay, well, we'll follow behind. You go." Yep, a stability belt. Yes, Laura Murray. So that was my black belt that I earned. Um, Georgian friends, it definitely it was. I was so happy to see how excited the doctors were. No matter which one of the five that came in to see me every day, they just could not believe I had had a total gross resection of a brain tumor 2, 3, 4 days ago. They were just they couldn't believe it, and I'm like, look, guys, when I got God on my side, I can do anything, and I know He's got my back, and it was just amazing, and even the people at the nurse's desk every day, they would cheer me on, and it just made me so happy. So hi, Bijou. Miss Liability, hello, welcome in. Hey, Stephen, thank you for coming in as well. Oh, Stephen, I'm sorry, I got you earlier, but yeah, it was really incredible, and it boosted my spirits too, hearing how happy they were with how I was doing. But I never had blurry vision. I never had any hearing loss. I had no problem sleeping. They kept me, I was able to sleep in bed lying down. However, that's boring to me, and I know for the most part that's in a hospital you don't really want to do that. So I moved around from the chair to the bed. Sometimes I stood up and looked out the window. It's pretty cool from because of where the hospital is. It's very close to our Busch Gardens theme park, so I could look out the window and see Busch Gardens, their roller coasters, could watch all that. So that was really neat. And then on day 4, I um, I was relieved of the stability strap, and I was taken. They asked if I wanted potentially um, some sun. Do I want to get some vitamin D? I said, absolutely, let's go. So they had me walk, and I did this on my own. No strap, um, no walker, nothing. Was able to walk. They had a little terrace and could sit out on the terrace. And what was even cooler is you're even closer to Busch Gardens. So you could hear the roar of the roller coasters, and it was so neat to see and hear. And, again, just more amazed people that I was doing what I was doing. And then by day 5, I was ready to go. I'm like, every doctor's released me to go home. Let's go. Come on, let's go. So that they were able to get that accomplished and was able to come home. So I was in the hospital for about, well, let's see. Considering I got there, let's see, I think I got there on a Thursday. So I was there on a Thursday and Friday. Saturday was surgery. And then Sunday, Monday, Tuesday, Wednesday, and Thursday. So I was in there about 5 days after post surgery. I showed them. I actually went in and took a shower. I'm like, man, I'm starting to stink here. I need a shower. And they're like, well, we can give you a sponge bath. I'm like, about a sponge bath. I'm like, nah, come on, I can make it. And I did. I walked into the shower, took a shower, no problems. So that was nice. Thanks, William Brooklyn, and I'm so glad they do, and that's why I hate myself for not going live yesterday, because I know you needed that, and I just yesterday was a rough day, not medically. I had a lot of stuff going on, and so that's why I didn't. But thank you, Maria. Same for you, Stephen. Thank you for both saying that. You know, I do have a strong soul, but for me, it's in the hands of God. I've been a Christian since I was 5 years old. I asked Jesus come into my heart and forgive my sins, and I pray every night that He continues to forgive me of my sins. I know I'm not perfect. I'll never be perfect. And I felt so bad, Sweets and Beyond, because I said on a previous live that I was going to ask him today when I went his thoughts on Yucca, and I totally forgot about it. But if he had Yucca in him and that's why he was able to do the surgery, then I'm grateful for Yucca. But now he is just an amazing surgeon. Hey, Cornhole, welcome in. I thank you for coming in again. It's nice to see you. But yeah, so this is I want to read to you. Sorry, this is the back of the pamphlet. There he is, Dr. Olivera. I want to read to you all his credentials and what his specialties are. So he is a board certified neurosurgeon with subspecialty fellowships training in complex cranial disorders, skull base, and cerebrovascular surgery. He has a special interest in all forms of brain and spinal cord tumors, as well as vascular abnormalities. He also treats hydrocephalus, brain and spine trauma, craniocervical junction abnormalities, spinal degenerative disease, and disc issues. He's fluent in English and Spanish, and he sees patients 18 years and older. I pray nobody ever needs a neurosurgeon. But if you need a neurosurgeon and it's in your budget, come to Tampa, Florida, and see Dr. Raul Olivera. He is truly the most remarkable doctor and surgeon I have ever known. His education, he got his medical degree from the Superior Institute of Medical Sciences of Havana, Cuba, and Autonomous University of Central America, which is in San Jose, Costa Rica. His pre-residency fellowship was here in Florida. Was at the University of Miami School of Medicine fellowship. Also, Jackson Memorial Hospital in Miami, Florida. His internship was done at the Neurological Surgery, St. Louis University in St. Louis, Missouri. And his fellowship was skull base and cerebrovascular at the University of South Florida, which is here in Tampa, Florida. Fantastic medical school. Let's see. And then his specialties: acoustic neuroma, vestibular schwannoma, brain and spinal abscesses, brain and spinal cord tumors, brain and spinal cord arteriovenous malformation, brain and spinal cord dural fistulas, carpal tunnel syndrome, intracerebral and subarachnoid hemorrhage, hydrocephalus, herniated disc, spondylothosis or something like that. I forget how it's said. And spinal stenosis, pituitary tumors, ruptured and unruptured intracranial aneurysms, skull base tumor, spinal stability requiring instrumentation, stroke, subdural and epidural hematomas, traumatic brain injury, trigeminal neuralgia and hemifacial spasms, as well as ulnar compression syndrome. So this guy is a true specialist. And it's it really is remarkable. And I will say one of the things that I absolutely love about having him as my neurosurgeon. Um, Maybe Maria, did you bother him or cook for him? I'd get sick too. Just kidding. I'm just kidding. So, you know, he truly saved my life, and you know, I've thanked him numerous times, shook his hand, and told him, "Thank you for saving my life, or extending my life." You know, God only knows, you know, when I'm going to be called home, but He has given me a chance at fighting and continuing because of how special He was at this and how delicate He was with the surgery. No, nothing was done wrong. It was the perfect surgery, and a complete resection, or they call it a total gross resection, is almost impossible. But God had this tumor grow on the right side of my head. It was fully accessible, which definitely went in my favor. But still, it's an intricate surgery. You have to be very, very careful because, like I said, we're talking millimeters, not even inches, millimeters away. You know, one way to the left, one to the right. That could, you know, make me lose a function of mine. So yes, so Dr. Olivera, I am always grateful for, and I'm grateful that God put him in my life, and put him at that hospital when I needed him the most. God knew I was going to need him, and called him to that hospital, and I'm always going to be grateful for that. So after I went home from the hospital, I had to go back and see him a little bit after going home, and I've had to do regular follow-ups with him ever since. And now we're at the point where everything is looking great. I am 8 months post surgery, and the only thing that's in my head right now is a very healthy brain. I don't have any tumor. I don't have anything showing besides a healthy brain. My MRIs look clean and perfect. And he even said today that he couldn't be happier with what he's seeing. And even his nurses who work for him, never forget, while we were waiting for him the first time we went back, his nurse, nurse practitioner, her name was Katie, and saw her in the hospital a couple of times, and we're so happy. Me and Mom both were so happy to see her at his office, at his clinic. And she was like, "You just don't understand the way he stitched this up." He was so excited when he stitched it all up, the incision up, because it was a difficult incision. And he just got so excited in the operating room when he got it stitched up, and saw, because they did a MRI while I was in surgery, and he saw that he got everything. He was so excited. You wouldn't have known that because you were knocked out. I said, but still. She's like, "Oh, he gets so intense. He gets so worked up because he treats every patient like, they're his own, either kin, son, whatever." He treats them like that, and he takes it seriously. So again, just an amazing, amazing human, amazing surgeon. And if anybody ever has to have any type of neurosurgery, I'd recommend looking at Advent Health Hospital for Dr. Raul Olivera. And Advent Health is all throughout Florida, but this is specifically the Advent Health Tampa location. And gosh, he's just wonderful. Hey, Brittany, welcome back. Welcome back. Nice to see you again. So yeah, that is my neurosurgeon, Dr. Raul Olivera. I will say, every time I see that guy, he gives me a hug. I should be the one giving him a hug for what his handiwork did. and he's giving me a hug because he's happy to see me. He's happy to see me alive, doing well. And, you just can't feel more in great hands than you do with him. And it's just, it really is, Maria. That is a great man. He really is. And I know my mom, I know she can't come on tonight, but um, she would say, just in the waiting room when he came out, he was, she goes, he looked like he had been through a 12-round fight. He was really intense. And it's just because he took everything so seriously and wanted to make sure that he got me back to my mom and back to my family and back to my friends without any issues. And by God, he did. And so he really is a remarkable person. And again, just the most amazing neurosurgeon. So, if you're watching this tonight, or if you're watching this on replay because YouTube suggested it to you, I hope you nor your family ever has to have neurosurgery. But if you do, you need to look this guy up. He treats patients 18 years and up, and he's just remarkable. I can't say enough great things about him. If every doctor took their patients as seriously as he did, I think the world would be, at least the medical world would be, a whole lot better place, and we'd have a lot less malpractice going on, because he really does take his job seriously. And I love going to see him because I know I'm going to get a hug. And this man cared, again, he cared so much about saving my life and just performed the most beautiful surgery. And so he came up today. I had my Optune device off because today was the day I changed my electrodes. So I had this off this morning when I went and saw him. It was an early appointment at 8:45 this morning. And it was cool. He's like, "Oh, I can see the scar." And he just ran his finger along the scar. He goes, "Man, that's a beautiful scar." And it's just, it was awesome. I'm like, well, I had a pretty great surgeon. And yeah, it was so great to see. Yeah, Maria, I would agree with that. But I never feel rushed. If I needed him to sit down with me, talk forever, he would. And yep, we get it right. And he even, anything you want to ask me, I'm like, well, here's what we're doing. I mean, we're on, one of the things that I have not gotten a definitive answer on, let's see, next month or this month, I'll have my 6th cycle of my what's it called, maintenance chemo, which is when I take it 5 days for the month, the entire month. I just take it 5 straight days. So initially it was supposed to be 6 cycles, but I left the old oncologist who said that. So I had my radiation oncologist last week. When I saw him, he said, whatever you're doing and everything you're doing is working. I said, so what you're saying is if it's not broke, don't fix it. He goes, yeah. So he goes, usually 9 months or 12 months is what you can do. So that was my radiation oncologist. Today, when I went to see Dr. Olivera, he said, it's working. Everything's working. So I said, oh, so you're saying if it's not broke, don't fix it. He goes, yeah. So it was so great. So the only other person I need to ask is my medical oncologist, who's the one that actually prescribes that. So I just want to see what he has to say. But at the end of the day, I know it's my, it's my treatment. It's my decision. and I will at least do 9 months. So I'm going to ask when I go to the medical oncologist April the 8th. So when I go next week to the medical oncologist, I'm going to ask him his thoughts and let him know that I would like to do it for 9 months and with the option of doing 12. So any more than a year, and I've seen the research on this. Also, my original medical oncologist shared as well. They don't like to do it more than a year because the chemotherapy can destroy your blood cell counts, your platelets, things like that, and potentially cause leukemia. So, needless to say, that is a risk, and we'll see, what my medical oncologist thinks. But usually, it's people who are long-term users of the chemo drug that I'm on, temozolomide. So, yeah, I'll have, hopefully, have 3 definitive answers from the doctors, and then if not, it's really up to me, and I have to make the best decision for what I feel is my health. So yes, Brittany, thank you. Praise God. 100%. Brittany, can I just say the shirt that I think I saw in one of your pictures, Brittany used to work with me, and I believe in one of the pictures I saw, it said something about praise Jesus, but something. I want to say it said, I praise Jesus, or I believe in Jesus, or I forget what it said. You can probably tell me better. But I curse or something like that. It cracked me up. I just wanted you to know. So yeah, Dr. Olivera, amazing guy, amazing neurosurgeon, and 100% recommended. So I love Jesus, but I cuss a little. That's what her shirt said. I thought I caught that in the background. That was, or not background, but as it went by on the story, that cracked me up. So yeah, I'm so grateful for where I'm at. 8 months away from or post surgery. Dr. Olivera, who performed the surgery, definitely is happy with everything that he accomplished, and like you said today, couldn't be happier. Things couldn't be better. Everything is great. So I'm so blessed that God has put the people in the medical field that helped me and are part of my medical team. Even when I had to switch from one medical oncologist to another one, I knew I needed to. I prayed about it, and I was given a reason why I needed to seek a second opinion. And I'm not going to say the name because he's a good doctor. But I asked him, okay, we're almost done with the 6 doses of the maintenance chemo. What do we do after that? I like to, especially when it comes to my health and cancer, I like to have another weapon in the arsenal, like ready to go. And he was just like, nothing. We don't, it's nothing. He didn't mention this Optune device. He didn't mention immunotherapy, which is the Keytruda. He didn't mention anything. So I'm like, yep, that's the sign I needed, God. And so went to the second opinion at Moffitt Cancer Center with Dr. Grogan. And he's like, you're young. We'd be dumb not to throw everything at it because you're doing so well. All your numbers look great. We'd be stupid not to throw everything at it. And I love Dr. Grogan and even his physician assistant Amal, his nurses. They're all just great. I have I think I have accumulated the best medical team that I think I could have grouped together. And again, God putting the right people at the right time. Hi, IPP Gate. So, yeah, and Dr. Grogan at Moffitt, another one who gets so excited when I ask him, "Hey, I was reading about this new device called Optune." He was like, "Yes, it's one of my favorite devices. We're going to put in your referral for it, and you'll have it in a couple days." I think it was 3 days later, 2 days later, I got a call from Optune saying, "We're ready to deliver your device." And so, I love having doctors who want to be proactive and who show that the decisions they're making are for thinking long term and not just at the moment. So grateful for the medical team that I have assembled, and they're my Avengers, I guess we can call them. And Dr. Olivera, he heads that up. He'd be, I don't know which one he'd want to be, but he's definitely the Iron Man of the team. He's solid, just solid as a human being and as a neurosurgeon. So I hope that gave you an idea of how amazing Dr. Olivera is. At any time, if anybody ever needs a neurosurgeon, Brittany, I try to go live Monday through Friday, and I try to go around 7 every time. Yes. One thing you can do if you have a YouTube account. If you have a YouTube account, it'll give you the option, like when you go to my main page, it'll give you the option to subscribe, and it doesn't cost anything. It's not going to ask you for a credit card or anything. You just hit the subscribe button, and right after you hit the subscribe button, it should give you a bell icon. If you click the bell icon and then in the drop down select all, that is going to tell you anytime I go live. It'll send a notification to your phone, a push notification to your phone. That way you don't have to look or worry or even ask me, contact me about, "Hey, when are you going live tonight?" But yes, as a general rule, it's Monday through Friday on around 7 o'clock. But I have done surprise lives on the weekend. So, that's why it really does help to have the subscribe and the notification bell hit. So, all right. So, everybody in here, my supporters, anybody new, anybody watching on replay, please know I love you all. I appreciate you letting me share my experience and my time with Dr. Raul Olivera. If anybody at any time needs to see a neurosurgeon and you're thinking about Dr. Olivera, I will be more than happy to talk to you one-on-one. So you don't have to ask everything in front of everybody. I mean, that's completely up to you. You can do that if you're comfortable. But I'll be happy to talk to you one-on-one, whether we do a call through Instagram or something. I will gladly do that and, give you my advice and how to get in to see him. I didn't have the option to schedule an appointment to go see him. I went straight from the ER to the hospital, and he was there to greet me, to welcome me, and talk about everything he was seeing. So just an amazing doctor, an amazing human. So again, I'm grateful for everybody. We have such a great community. Thank you all for being here, talking in the chat, interacting. If you ever have any questions, this live is always going to be out there. You can ask a question as a comment on the live. I'll be more than happy um, to answer them, and I do. I acknowledge and answer pretty much every comment on any post that I make or any video that's out there. So, y'all are taking the time to come see just me talk about brain cancer and my experience with brain cancer and how I'm able to remain positive and, not be scared of what the future is. So, that means to me more than anything, because you're taking time out for me. It means the world. So, again, I love you all. I will be live again tomorrow night for a Thursday show. Looking forward to it. I don't know what we're going to talk about yet. I have some things that I'm thinking of, but not going to share those yet. But, I hope everybody here has a great night. Great day tomorrow. God bless you all. And your families as well. So thank you again for being here watching me. I love you all, and I look forward to another night tomorrow with you all. So everybody have a great night. Thanks for coming in, and tomorrow's a new day. Have a good one.